Her name was Helen. She was 76 years old, lived alone, and spent most mornings tending her roses. She was vibrant, full of life, and still sharp as ever. One spring morning, she noticed something. An itchy red spot on the back of her shoulder. Small, flat. It looked like a rash or maybe a bug bite. She ignored it. For weeks, then months. She said, "It's probably nothing." But it grew, darkened, bled slightly when she scratched it in her sleep. By the time she showed her doctor, it was stage 2 skin cancer. And the doctor told her, if you had come 6 months earlier, this would have been simple. Today, Helen is okay, but only because she caught it just in time. Skin cancer in older adults is more common than most people realize. And often, the warning signs are dismissed as dryness, irritation, or age spots. But there are 3 signs in particular that doctors say must never be ignored, especially in seniors. Let us look at each one closely. Many seniors deal with dry skin, but if there's one area that stays irritated, flaky, or red for more than 3 weeks, even after using lotion or cortisone, it could be a precancerous lesion. This is especially true on the scalp, back, ears, or chest, areas often exposed to sun. The American Academy of Dermatology warns that actinic keratosis, a common early sign of skin cancer, often starts as a rough, scaly patch that itches and feels stuck to the skin. Philosopher from the United States, Ralph Waldo Emerson, once said, "The first wealth is health. It's not just old skin. If it itches and doesn't go away, get it checked." Early treatment can stop cancer before it begins. One of the most dangerous warning signs is change. When a mole, spot, or patch becomes darker, irregular at the edges, or starts bleeding without injury. This is often a sign of melanoma, the most serious form of skin cancer. Seniors are especially at risk because these changes are easy to miss or dismiss as just aging. According to the Skin Cancer Foundation, nearly 50% of melanoma deaths occur in people over 65, and most of those started with one small spot. Philosopher from France, Pascal, once said, "People are generally better persuaded by the reasons which they have themselves discovered." So go look, use a mirror, ask a loved one. If something has changed, let a doctor decide if it matters. Dermatologists call it the ugly duckling rule. If one spot stands out, darker, rougher, shinier, or shaped differently, it needs medical attention. Even if it is small, even if it doesn't itch or hurt, it could be basal cell carcinoma, the most common cancer in America. It starts slow, but spreads deep, damaging tissue, nerves, and bones if left untreated. A recent Mayo Clinic study found that early detection of unusual spots can lead to a 99% survival rate, but late detection drops it dramatically. Philosopher from Greece, Hippocrates, once said, "Extreme remedies are very appropriate for extreme diseases, but the best remedy is catching it before it becomes extreme." Helen's spot was itchy, but quiet. It didn't scream for attention, it whispered, and most cancer in old age begins like that, not as pain, but as a silent invitation. Check your skin, watch for changes, trust your instincts, and never be ashamed to ask a doctor, even if it feels small. Because your life is not small, it is still unfolding, and one check might be the reason it keeps going.